Be careful. Your stool's smell and shape can tell you about your health. Today we're diving into a topic that's crucial for your health, but often overlooked: your stool. Have you ever noticed unusual smells or shapes in the bathroom? It might seem embarrassing, but your stool can tell you a lot about your digestive health. From metallic odors to strange shapes, each sign could be a clue to what's happening inside your body. Stay tuned as we uncover what different stool smells and shapes could mean for you. And when it's time to see a doctor. Stool smells. While stool never smells pleasant, it can sometimes have an especially strong and unpleasant odor. The most common cause of foul-smelling stool is your diet. However, in some cases, certain odors can indicate a health condition. This can happen when organs aren't functioning properly, increasing the levels of smell-causing molecules in the body. For example, the food you eat is processed by your gastrointestinal digestive organs and by bacteria in your intestines. Some types of bacteria may produce smelly substances as they digest food. Normally, your liver breaks down these substances to neutralize their odor and your kidneys remove them from your body. Problems with these organs could result in unpleasant smelling stool. Stool that smells like ammonia. Ammonia has a strong recognizable smell often associated with household cleaners or old urine. Your large intestine produces ammonia when it digests protein. Normally, your liver neutralizes the ammonia, helping your body eliminate it. If your stool smells like ammonia, it may indicate a problem with your liver, such as liver disease. Additionally, certain bacteria in the large or small intestines can produce high levels of ammonia. Therefore, ammonia-smelling stool might signal an imbalance between good and bad bacteria in your digestive system. Stool that smells like metal. A metallic smell in your stool may be caused by the presence of iron. Iron is an essential component of hemoglobin, a protein in red blood cells that helps transport oxygen throughout the body. When there is blood in your stool, it can produce a metallic odor. This could be a sign of several health conditions, including inflammatory bowel disease, hemorrhoids, anal fissures, diverticulitis. Additionally, taking iron supplements can sometimes cause your stool to appear as if it contains blood or to have unusual smells. Stool that smells like rotten eggs. A rotten egg smell in your stool is typically due to the presence of sulfur. Sulfur odors can originate from your diet, particularly from sulfur-containing foods such as meat, fish, dairy, eggs, and alcohol, as well as cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts. Foods with sulfite preservatives, including sulfur dioxide, potassium bisulfite, or sodium metabisulfite. Certain medications and supplements that contain added sulfites. Excess sulfur in your digestive system can also be a sign of an infection. Malabsorption syndromes. Malabsorption refers to various conditions that make it difficult to digest certain foods, often leading to foul-smelling stool. Examples include lactose intolerance. Lactose is a sugar found in milk and dairy products. The enzyme lactase breaks lactose into two smaller sugars, which the gut absorbs into the bloodstream. People who are lactose intolerant don't produce enough lactase, causing indigestible lactose to draw water from the bloodstream into the intestines, resulting in loose, foul-smelling stool. Milk allergy. A milk allergy differs from lactose intolerance. According to the American College of Allergy, Asthma and Immunology, ACAAI, those with a milk allergy have an overactive immune reaction to milk products, similar to a peanut allergy. This reaction can cause hives, rashes, or swelling of the lips, tongue, and throat. It can also lead to bloody, strong-smelling stool due to immune system irritation of the gut. Celiac disease. The American Gastroenterological Association, AGA, states that people with celiac disease have an immune reaction to gluten, a protein in wheat, barley, and rye. The immune system attacks the lining of the small intestine in response to gluten, causing difficulty absorbing vitamins and nutrients. This malabsorption can result in fatty, unpleasant-smelling stool and other complications. Ulcerative colitis. Ulcerative colitis is a chronic form of inflammatory bowel disease, IBD, where the colon's lining becomes inflamed and develops ulcers. Experts believe the immune system mistakenly attacks good intestinal bacteria, leading to chronic inflammation. This results in bad-smelling stool with blood or mucus. Crohn's disease. Crohn's disease, another type of IBD, can cause persistent, foul-smelling diarrhea. It can affect any part of the gastrointestinal tract, from the mouth to the rectum, similar to ulcerative colitis. Chronic pancreatitis. Chronic pancreatitis is long-term inflammation of the pancreas, leading to oily, fatty, foul-smelling, pale-colored stool. It causes permanent damage, impairing the pancreas' ability to digest food and produce hormones, exocrine pancreatic insufficiency. Exocrine pancreatic insufficiency occurs when the pancreas doesn't produce enough digestive enzymes, leading to indigestion and foul-smelling stool. It can also cause poor absorption of vitamins and minerals and unintended weight loss. Short bowel syndrome. Short bowel syndrome, SBS, is a rare condition where part of the small or large intestine is absent or non-functional. People with SBS often experience pale, greasy, smelly stool and nutrient malabsorption, leading to serious complications. SBS can result from various causes, including surgical removal of intestinal sections after unsuccessful IBD treatments. Speaking of shapes, have you ever wondered if the form of your stool is normal? If you still don't believe that watching your stool is important, some scientific research may convince you. To distinguish the types of poop and help people stay healthy, scientists from the Bristol Royal Infirmary created the Bristol Stool Chart. It describes 7 types of feces and what they mean. So, let's reveal these types and find out what your stool shape says about your digestive health. Type 1. If you see separate, solid lumps that look like nuts or goat droppings in your toilet bowl, it's likely a sign of severe constipation. This type of stool indicates that your body is lacking fiber. To remedy this, try eating more fiber-rich foods like fresh fruits and vegetables, grains, nuts, seeds, whole wheat pasta, beans, and lentils. According to the American Dietetic Association, Americans typically consume about 0.5 ounces of fiber a day, which is much less than the recommended amount. Women under 51 should aim for 1 ounce of fiber a day, while men of the same age should target 1.3 ounces. Additionally, if you're dealing with constipation, consider natural laxatives like prunes. These dried plums contain enough sorbitol to have a beneficial effect. Type 2. If your stool is sausage-shaped, large, and lumpy, it indicates constipation. This type of stool is also caused by a lack of fiber. Non-dietary reasons for constipation can include long-term use of anti-diarrhea medication and lack of physical activity. To combat constipation, try eating more fruits and vegetables and engaging in regular exercise. Physical activity helps your body move food more quickly through the large intestine. Aerobic exercises like running, jogging, or swimming can enhance muscle contractions involved in digestion by increasing your heart rate and breathing. However, avoid exercising right after a big meal, wait an hour to prevent bloating and excess gas, stretching, certain yoga poses, 15 minutes a day. Type 3. If your stool is sausage-shaped with cracks on the surface, there's no need to worry. This is considered normal. You're doing just fine. However, to maintain this healthy stool, remember to stay active and drink plenty of water. Constipation is often linked to dehydration in the colon, so it's important to keep yourself well hydrated. When your body is properly hydrated, less water is absorbed from the colon, keeping your stool soft and easy to pass. Just what we all need for comfortable digestion. If your stool is soft, sausage-shaped, and smooth, congratulations. Your stool is as perfect as it can be. To maintain this healthy stool, continue eating a balanced diet and try to avoid stressful situations. We all know the feeling of needing to go to the bathroom during an important meeting, exam, or family event. However, holding in your bowel movements can lead to constipation if done repeatedly. To avoid this, try to manage stress and maintain a healthy lifestyle. Remember, taking care of your digestive health is key to overall well-being. Type 5. If your stool consists of soft lumps with clear edges, it may indicate mild diarrhea or a condition known as irritable bowel syndrome. IBS is a chronic condition that requires long-term management. People with IBS can often control their symptoms through a healthy diet and lifestyle. To alleviate symptoms, try eating low-fiber foods such as bananas, crackers, and potatoes. If your stool comes out in fluffy pieces with ragged edges, it looks like you're experiencing mild diarrhea. Remember how we recommended more fiber earlier? In this case, the issue might be too much fiber in your diet. To manage this, drink plenty of fluids to avoid dehydration and stick to foods like boiled potatoes and bananas. You might also consider over-the-counter medications like Imodium or Pepto-Bismol, which can help slow down intestinal movement and form more solid stools. If the problem persists for more than 2 days, it's important to consult a doctor. Type 7. If your stool is liquid without solid pieces, it indicates severe diarrhea. This type of stool is never pleasant and may signal issues such as food poisoning, lactose intolerance, or diabetes. Bacterial infection, or side effects from medications like antibiotics, heartburn and acid reflux medications, or chemotherapy drugs. To manage severe diarrhea, drink plenty of water to prevent dehydration and consider over-the-counter medications. Severe diarrhea typically doesn't last long. However, if the symptoms persist for more than 2 days, or if you experience pain and fever, consult a doctor immediately. You can find many interesting videos about the benefits and harms of vegetables and fruits, as well as diseases and their treatments. So please don't forget to subscribe to the channel and hit the bell icon. I would also appreciate it if you could like this video and share it with your family and friends.